Hello guys. So now we shall be discussing regarding the cervical spine. Okay. So in the cervical spine mainly we will be focusing on C1 as well as C2. C1 is called as your atlas and C2 is called as your axis. Okay. So we'll be talking about the cervical spine. So regarding the cervical spine, two cervical vertebrae I have just talked about. One is called as your C1 and the other one is called as your C2. C1 is called as what? C1 is called as your atlas. And C2 is called as what? C2 is called as your axis. So one is called as your atlas and the other one is called as your axis. Now when it comes to the characteristic features of atlas and axis, what are the important features which you would see? Right. So the first important feature which you would see over here is that, see, this bone which you can see is called as your atlas, right? So it is not having any kind of odontoid process, so that is why it is not called axis. So for axis, what do we have? For axis we have got odontoid process. Odontoid process. Now what do I mean by that is, for if you look at the axis bone is having a small process like this. This is called odontoid process, right? So atlas is having an opening here. So into this opening, the odontoid process will fix into this opening, and that is the reason why this joint, whatever is formed, is called as a atlanto-axial joint, that is formed between atlas and axis. Okay, so what can happen is that you can rotate your head to and fro, right? You can rotate your head right, left, up and down. Okay, so this is done by this particular joint, and that joint is called as your atlanto-axial joint. So atlas and axis together form a joint, and that joint you call it as atlanto-axial joint. Atlanto-axial joint. Okay. Now if you look at the parts of the atlas over here, so this particular opening which you can see over here, this is what is called as your transverse foramen. Okay. So what is this? This is called as your transverse foramen. Now after this transverse foramen, this particular opening over here is called as your vertebral foramen. Vertebral foramen. Right. Now after this vertebral foramen, down here you see two processes, right? How many processes are there? You see two processes, and by the way, this is called as your spinous process, right? Spinous process is having two processes like this, that is why you call it as bifid spinous process. Bifid spinous process. So you call it as bifid spinous process. Okay. So there are three important characteristic features which you can see. One is called as, what is this? One is called as a transverse foramen, and the next one is called as a vertebral foramen, and next you have got is a bifid transverse process. Okay. Now let us compare atlas and axis together, but before comparing atlas and axis, let us look at the real bone and let us see how does it look. So this bone over here is called as your atlas. Now to this atlas, this opening over here which you have is called as your vertebral foramen. Vertebral foramen. Okay. After vertebral foramen, I also told you transverse foramen. See, this is your transverse foramen. Transverse foramen. Now after this transverse foramen, what did I tell you? I told you that the spinous process is bifid, right? So you see bifid spinous process. So this is bifid spinous process. Okay, so this is your bifid spinous process. Now after this bifid spinous process, what we'll do is that we shall just compare atlas with the axis. We shall compare these two bones and see what are the minimum differences which we have over here. So this bone over here which you can see is called as your atlas, which is called C1, and this one over here is called as your axis, which is called C2. What did I tell you? I told you that axis is having a process called odontoid process, right? You see a hook-like projection, not hook, a process-like thing. This one over here is called as your odontoid process. Odontoid process. Okay, so this is called as your odontoid process. Okay. Now what will happen is that this odontoid process exactly fits into this odontoid process. Okay. So as it is fitting into that, what will happen? It will very easily rotate. Okay. So what you need to know here is that odontoid process is present only for C2. It is not present for C1. Then what is this thing over here? I am telling you that this is not odontoid process here for C1. This is the place where this odontoid process is fixing into this. You are getting it, right? So this opening, whatever is there, this is the opening where the odontoid process will fix into this. So that is why I have written it as odontoid process. This doesn't mean that C1 is having odontoid process. No, C1 is not having any odontoid process. It is completely empty. This region is completely empty. So into this empty region, this particular odontoid process fixes into that and forms atlanto-axial joint. Okay. Next important thing is that if you look at the C1, on either sides of the C1, you see this structure here, right? So you see this particular structure here as well as on the either side as well. So these two structures are called as the lateral masses. How many lateral masses we have got? We have got a right lateral mass, we have got a left lateral mass. So this one is called as a lateral masses. So these two structures are called as lateral masses. Okay. Now, if you look at the odontoid process, in front of the odontoid process, you have got a ligament, right? You see this ligament over here. This ligament that is located in front of odontoid process is called as transverse ligament of the atlas. So this is called as transverse ligament of atlas. So this is called transverse ligament of atlas. So these two lateral masses behind, I mean posterior to the lateral masses and anterior to the lateral masses, there are two arcs. What are these two arcs? See, here you see this particular arch over here, right? And next, all the way down here, you see another important arch. So how many arches are there? See, one arch you have on the back, one arch you have on the front, right? So this is called as your anterior arch. This is called as your anterior arch, and this one over here is called as your posterior arch. So one is called as your anterior arch, another one is called as your posterior arch. Okay. Now, after discussing these arches, one very important thing you need to know, right? If I am rubbing this part, here, you can very clearly see a groove on both the sides. Now look here closely. See here. Do you see a small groove here? Here also, do you see a small groove like this? Yes or no? I am rubbing it out again. So this is a groove that is present on which arch? Anterior arch or posterior arch? It is present on the posterior arch. So on the posterior arch, see, this is your posterior arch like this. Okay. On the posterior arch, you see a groove in this way, right? So that groove is the groove for vertebral artery. So on the posterior arch, you have got a groove for vertebral artery. Okay. So this is all the discussion regarding your atlas. Now when it comes to the axis is having odontoid process, but atlas is not having odontoid process. That is one difference. Second difference is that if you look at axis vertebra is having spinous bifid process, spinous bifidus process or bifid spinous process, whatever it is. So let me write it down as bifid spinous process. So this is your bifid spinous process. Okay, this is your bifid spinous process. Now along with this bifid spinous process, do you see bifid spinous process in C1? You don't see it in C1. You see in axis only. So this is the only bone that is your axis. Okay, this is not atlas. So here also you see bifid spinous process. So this is also your axis. This is your axis bone, right? So this is also your axis bone because you have got bifid spinous process. And next, transverse foramina are common, vertebral foramina are common. You see, these are your transverse foramina, right? So this particular part over here is your transverse foramina. This is called as your transverse foramina. After transverse foramina, this facet which you can see over here is called as a lateral mass. What is the other name for lateral mass? Even axis, even atlas is also having lateral masses. But tell me what is the other name for this lateral mass? The other name for this lateral mass is superior articular facet. superior articular facet. So that is the other name for this lateral mask. Okay, so that is the other name for this lateral mask. So these are some of the very important key differences which you would see between the axis as well as your atlas, right? Next important thing is that let us look at what are the different kinds of ligaments does this vertebral column having. Okay, so what I will do is that I will show you the ligaments that are present over here, and I will also tell you what ligaments are present throughout your vertebral column and what ligaments are only present to the cervical region. Okay, for example, if you look at this particular picture, in this particular picture you know that these are vertebra. I don't know what vertebra are they, but these are the vertebra. Now what they have done is that they have cut open the vertebra in this way and they are showing you the ligaments. So if you look at these ligaments over here, see this particular ligament which you can look here, right? You see this particular ligament which you can look over here, this is more anteriorly present and it is longitudinal or circular. It is longitudinal, right? So let us say this is the anterior part and all the way till here is the posterior part. So this ligament over here is called as your anterior longitudinal ligament. So this is your anterior longitudinal ligament. So what ligament is this? This ligament is called as your anterior longitudinal ligament. Now back to this anterior longitudinal ligament, this particular ligament over here is called as your posterior longitudinal ligament. Posterior longitudinal ligament. So you have got two ligaments over here. One is called as the anterior longitudinal ligament and the other one is called as a posterior longitudinal ligament. Next, after that you see this blue color ligament over here. This particular blue color ligament over here is what is called as your ligamentum flavum. So this is called as ligamentum flavum. So this one is called as your ligamentum flavum. After this ligamentum flavum, you see another ligament that is present here, this green color ligament, right? So this green color ligament is present in between the two spinous process. So in between is called spinous process is called spinal ligament. So this ligament is called as interspinal ligament. This ligament is called interspinal ligament. And finally, we have got one last ligament over here. This ligament over here is called as your nuchal ligament. This ligament over here is called as your nuchal ligament. Right. So what are the different kinds of ligaments you've got over here? The first important ligament which you can see over here, right, that is called as your anterior longitudinal ligament. Next you have got is a posterior longitudinal ligament. Third you have got is a ligamentum flavum, next nuchal ligament and interspinal ligament. So these are the ligaments which you can see over here, right? Now what are these ligaments? These ligaments are called as your major ligaments. Now out of these ligaments which are present throughout the vertebral column and which are present only till the cervical spine. So we shall write down the ligaments present throughout the vertebral column and let us see what are the ligaments present only to the cervical spine. Only to the cervical spine. The ligaments that are present throughout the vertebral column, one is anterior and posterior longitudinal ligament. Anterior and posterior longitudinal ligament. Now after anterior and posterior longitudinal, next we have got ligamentum flavum. Ligamentum flavum. So that is the next important ligament. Third important ligament is your interspinous ligament. Third is your interspinous ligament. Next, when it comes to your ligaments of the cervical spine. So the first important ligaments which are related only to the cervical spine, one is called as the nuchal ligament. Okay, one is called as your nuchal ligament. What is this nuchal ligament? Nuchal ligament is nothing but the continuation of the supraspinatus ligament. So nuchal ligament is nothing but the continuation of your supraspinous ligament or supraspinatus ligament, right? Next important thing is that if you look here, where is this nuchal ligament present? So nuchal ligament is present all the way from C1 till C7. Okay. For example, if I draw the vertebra like this, right? So let us say that this is your vertebra and this is having a spinous process like this. This is another vertebra, right, having a spinous process. So let me multiply this. These are the spinous process, right? So to this spinous process, you see a ligament that is coming down. This ligament is called nuchal ligament. So it is ranging all the way from the spinous process of what? Spinous process of all the way C1 to C7, right? So that is what is called as your nuchal ligament. And second important ligament which is not shown over here is called as your transverse ligament. Okay, so that is called as your transverse ligament. So where is this transverse ligament present? This is called as a transverse ligament of atlas. Okay, so what are the ligaments that are present throughout the vertebral column, and what are the ligaments that are present only till the cervical spine? Throughout the vertebral column, we have got anterior posterior longitudinal ligament, ligament of flavum, and interspinous ligament. Only cervical spine we have got nuchal ligament, we have got the transverse ligament of the atlas, right? Now one very important clinical point which you need to know is that you see this cervical vertebra over here. Now in this cervical vertebra, what is happening? What is happening is that whenever you are diving, right, excessively into shallow waters, what will happen? There will be hyperextension of your neck. Whenever there is hyperextension of your neck, you already know that these two structures which are located on either side. What are these two structures over here? These two, okay, let me show it to you. These two structures are called as your lateral masses. We discussed it already. These two structures are lateral masses, right? So what will happen is that these two structures are lateral masses, and these lateral masses, they compress. The moment you hyperextend your neck like this, these two lateral masses, they compress. When the lateral masses, they compress, you see a fracture, right? So where is the fracture? The fracture is to the anterior arch, the fracture is to the posterior arch, right? So this kind of fracture is happening because of compression of lateral masses. So that is why this fracture is called as a compression fracture or Jefferson fracture. Okay, so compression fracture or Jefferson fracture happens in extended neck, right? So when you are hyperextending the neck, that would lead to compression. That would lead to compression of what? Compression of lateral masses. What are lateral masses also called as? Lateral masses are also called as superior articular facets, right? So because of this compression, the fracture whatever you have is this Jefferson fracture. Okay, next important fracture. Now in this fracture, what is happening? This fracture is also called as hyperextension fracture or whiplash injury. Whiplash injury, right? So what is this whiplash injury? For example, you are driving a car and suddenly you had to brake. Now when you are braking, what can happen is that suddenly there is hyperflexion and hyperextension in this way, right? So you see, as a whiplash, you take a whip and you lash it like this. So in the same way, your head also flexes and extends in this way, right? So this is called as a whiplash injury. So because of this whiplash injury, what is happening? There is hyperextension and hyperflexion. And when this hyperextension and hyperflexion is seen, only during collision, during the car collision. So because of this, what will happen? Now guys, by looking at this x-ray, don't think this is a whiplash injury. Okay, this is not a whiplash injury. This is called as a hangman's fracture. So I'll tell you about this later on. So regarding this whiplash injury or the hyperextension injury, what will happen is that usually you have got, let us say, C1, C2, C3, C4, C5, C6, C7. Okay, C1, 2, 3, 4, 5, 6, 7. So what is happening here is that most commonly, because of this, fractures are less common, but most commonly the worst thing that can happen is subluxation. What is subluxation? Subluxation means dislocation. Okay, so what will happen over here is that this particular C2 vertebra, whatever is there, this will move forward. Okay, so you see it has moved forward, which means there is subluxation. Now as it is moving forward, don't you think in the center here, you have got your spinal cord like this? In the center you have got spinal cord. You see now spinal cord is moving away. Because of this, the spinal cord is compressing, yes or no? So previously, how these things are present is that this is vertebra. This is another vertebra. This is another vertebra. In the center of the vertebra, you have got a spinal canal which spinal cord passes. Okay. So for example, this is one vertebra. This is another vertebra. Okay. You see this white color thing is spinal cord. For example, if there is sliding of my vertebra, it means dislocation. If my vertebra is coming forward like this. Now, don't you think spinal cord in the center will tear off? It won't tear off. For you to understand easily, I am telling you. But there can be compression of the spinal cord. Whenever the spinal cord compression happens, because of this, spinal cord compression happens. Okay. So, because of this spinal cord compression, what can happen? Very important thing you need to know, that this would lead to quadriplegia. So, paralysis of all your 4 limbs lifelong, that is called as quadriplegia. But most commonly, the subluxation happens at the level of C6 and C7. Around 50% of the cases, the subluxation is seen at the level of C6 and C7. Always and always remember, don't break your neck like this. You have a habit of breaking the neck like this, right? So, never ever do that. By chance, if there is a fracture or if there is a subluxation, what can happen? Your 2 hands, 2 legs, both of them will be paralyzed for lifelong. Okay. So, never ever do those things. And most important thing, patients who are having arthritis, right, never ever do vigorous yoga. You might think arthritis yoga is the cure for everything, but no. Whenever you have arthritis, right, there is increased tendency or increased risk of subluxation. When you are doing neck exercises, suddenly there can be cervical subluxation leading to quadriplegia. Okay. Right. So, this fracture, whatever you can see over here, is called as hangman's fracture. You see, what is hangman's fracture? Fracture of C2. Fracture of C2 is called as your hangman's fracture. Right. So, this is all you need to know regarding the cervical spine, guys. So, thank you so much for watching my video. Goodbye.